Hi, thank you all so much for joining us today for this important discussion on the integration of One Health into environmental health initiatives. My name is Hannah Marcus, and I will be facilitating this discussion today. I'm currently a co-chair for the WFPHA Environmental Health Working Group, through which I contribute to ongoing research, policy, and advocacy on climate change and health. I'm also currently leading the group's Climate Migration Health Subcommittee, and I've been involved in research on climate health governance, climate adaptation in the WASH sector, climate-related displacement and migration, occupational health in vulnerable labor settings, and community health worker programming, among other topics. I'm now working with an organization called Conciliant Research based in Somalia, where I'm speaking to you from. And I'm providing support with monitoring, evaluation, and assessments of large humanitarian and development programs with a focus on climate resilience building and disaster relief interventions in the Horn of Africa. That said, I am not the expert on today's topic. I'm just going to be facilitating the discussion between our much more knowledgeable speakers on the matter. So I'm very happy to invite you and to be able to have the honor of facilitating this panel discussion. So today's webinar, as you may notice, is hosted in honor of World Environmental Health Day, which falls every year on September 26th, and it serves as an annual reminder of the vital role that environmental factors play in influencing public health and well-being. And this is something that has gained a lot of traction in recent years, and that there is increasing recognition of, but that still warrants more work and more progress, and that's what we're going to be discussing in part today as well. And that's also what this day serves to remind us of. So for context, this webinar has been organized by ENFINET, RTI, and the World Federation of Public Health Associations Environmental Health Working Group, which is the organization I'm from. And the webinar's objectives include exploring successful environmental health initiatives within the One Health framework, with a focus on identifying key insights and lessons learned. And the second objective is to brainstorm policy and practical solutions to environmental health risks, with a focus on restoring healthy relationships between humans, animals, and the planet. So this webinar is part of a series of One Health webinars that ENFINET and RTI initiated in July of 2023. And the first webinar in this series was titled Sustaining Meaningful Multi-Sectoral Collaboration for One Health, Conditions for Success. So I'm pleased to introduce to you today the second edition of this webinar series, which covers the topic of One Health and its relation to environmental health initiatives and programming. So with that said, I'd just like to briefly discuss the topic of One Health and introduce it. I'm sure this is something that you're all familiar with, as it is a concept that has been brought to light in recent years especially. But for those that may not have heard of this topic or may be new to it, I'll just share the official World Health Organization definition. So the World Health Organization defines One Health as an integrated, unifying approach to balance and optimize the health of people, animals, and the environment. One Health involves the public health, veterinary, public health and environmental sectors, and prioritizes interdisciplinary collaboration to create long-term sustainable solutions. And this is something that will be explored further over the course of our upcoming discussion with our expert panelists. So with that said, I want to just start with a short video. This is, again, just a summary of the One Health concept. Would you please pull that up for us, Dana?
Meet Musa. Musa is a veterinarian. With other animal health professionals, he helps fight animal diseases and improve animal welfare. You know that. But did you know that, in doing so, Musa also helps keep you and your family healthy? The far-reaching impacts of Musa's work should not come as a surprise. In our globalized world, we are all interdependent. Animal diseases can affect the health of people, and human diseases can affect the health of animals. For example, when humans cut down trees, they affect the balance of the ecosystem and of all the creatures living in it. Usual ecosystem services such as food provision or carbon capture can become a challenge. Wild animals are sometimes forced to flee their natural habitats to find sources of food getting closer to villages. Animals and humans that should never have interacted so closely suddenly do. And dangerous pathogens can jump from one species to the next. Sound familiar? Around 5 new human diseases appear every year. 3 of them are of animal origin, as for example Ebola and most probably COVID-19. 60% of existing human infectious diseases come from animals. Deforestation is just one example. Unregulated wildlife trade, climate change, all affect environmental health, and with it, animals and humans. Musa and his colleagues are at the forefront of the fight against diseases that can affect the health of all. To create a healthier world, they need to work in collaboration with other sectors. The World Organization for Animal Health helps them come together with other experts to share essential knowledge, to build a global network, and to design a common response to global threats. Because we all share one world, we all share one health.
Thank you, Dana. I think that's good for now. I think because it's just freezing a bit, but we got most of the video in. Okay, well, thank you so much for sharing that. So hopefully that introduced to you guys the concept of One Health for those that may have been less familiar. And now I want to proceed with mentioning MFINET's role in this space just very briefly. So over the past year and a half, MFINET has released 2 resources to support the advancement of environmental health policy and practice in the Eastern Mediterranean region, which is the area in which the area that they focus on. And these resources include an operational guide on the implementation of a One Health approach in the Eastern Mediterranean region, which was released in April 2022, alongside an operational guide on integration of climate change action into health programs in the Eastern Mediterranean region, which was released later on in January 2023. And these resources are both publicly available on MFINET's website for those who would like to have a look at them. So now moving into the introduction of our speakers, we have with us today three speakers. Unfortunately, it seems one was unable to attend for personal reasons. They may or may not attend at some point, but for now we have 3 expert panelists with us, and these include firstly Dr. Chris Eby. Chris Eby is a climate health expert and professor at the University of Washington Center for Health and the Global Environment. We also have with us Dr. Chadia Wenis. Dr. Chadia Wenis is a One Health Global Coordinator for the World Organization for Animal Health. And finally, we have with us Patrick Ikwara, who is a founder of the Linda Mazingira Initiative in Kenya. And he is a member of the Forest Conservation Committee, where he represents civil society organizations in Kenya involved in conservation and climate change action. So with that said, I want to begin moving into the discussion. But firstly, some of our speakers have developed some slides just presenting some basic experiences that they've had working in this space. And so I'd just like to give a chance for those to be shared with us now. So I'm just going to hand it over to Chadia, who's going to start us off with some slides.
Thank you very much, Hannah. Just give me 1 second to open the presentation.
No problem. And in the meantime, I'll just mention to everyone that we're going to have a Q&A discussion at the end as well, engaging the audience. So for anyone who has questions, feel free to put them in the chat, and we'll be having a look at those and responding to them later on.
Yeah, thank you so much, Hannah. So my name is Chadia Wenis. I am the One Health Global Coordinator for the World Organization for Animal Health, and I am also the co-chair of the World Federation of Public Health for the Working Group on Health and Emergencies, and part of the Working Group on Environment with Hannah. Thank you for having me. I will just share 3 initiatives on the linkage between environment and health that we are working on currently as part of this important issue of One Health. And to start with, just a quick overview of the drivers of risk. We have seen much interest recently in the One Health as the way to address the drivers of risk if we are to prevent future pandemics. And to understand these drivers, we see that most of them, they are outside of the health system purview or mandate, and they include things like climate change, biodiversity loss, pollution, land use changes to have agriculture expansions, or to have development projects. But this has to be done in sustainable way so we can maintain the balance between the nature and between human and animal health and the health of the environment. And we also facing, although we have so much interest in One Health, we have a lot of underinvestment in the One Health system. From there, we have asked our One Health high-level expert panel that to provide the technical and scientific advice to the 4 organizations of the quadripartite, we call it, quadripartite collaboration on One Health, that consists of the Food and Agriculture Organization of the UN, FAO, WHO, and the UN Environmental Program, and the World Organization for Animal Health. So we asked them to come up with the definition of One Health to help us mainstream the understanding of this concept and approach. And as mentioned by Hannah, the definition says that it is an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animal, and the environment. And also to recognize that all these 3 sectors, they are interlinked and connected within the ecosystem that we all live in. And this approach also not just mobilize the sectors, but also the disciplines that come with the sectors, and also the different segment of the society, especially focusing on the vulnerable group where they face a lot of the drivers of risk. And we have to do this approach and implement it while thinking about the consequences and our contribution to the sustainable development. So from there, and responding to the international request and from our member countries, we have developed the One Health Joint Plan of Action, which will be a 5-year framework to help us advance and scale up the implementation of One Health. And we have launched this initiative at the World Health Summit in Berlin last year. And after that, we have worked on implementation guide that will be ready to be launched at the Conference of the Party, or COP28 in Dubai in December. This comprehensive plan has 6 action tracks. And as you can see, one of them is about integrating the environment into One Health, action track 6, which is new for our work, because usually we work the animal health and the human health, but now we are trying to integrate the environmental sector into our work. Importantly, all these action tracks on how to reduce the risk of pandemics, how to work on AMR, how to address food safety issues, all of this has to go through 3 pathways of change. The first one is about policy, legislation, advocacy, and financing that are needed to make One Health a reality in the field. The second one, it's about organizational development, the sectoral integration, the coordination mechanisms that are needed to do the work. And the third one, it's about data, evidence, and knowledge that has to underpin all the One Health interventions. Now, I want to give you an example of this linkage between climate change, environment, and health. And I will show you a new initiative that we are working on, which is called Nature for Health. And this initiative specifically will try to work on biodiversity issues and how they impact on animal health and human health. And the aim is to prevent future spillover of zoonotic diseases and to address the drivers, the upstream drivers, including biodiversity loss. And to do this, we have come together 8 of the founding partners, including UNEP, of course, the UN Environment Program, WHO, the World Organization for Animal Health, and UNDP. And we have with us also organization working on conservation like IUCN, and we have also the Convention on Biological Diversity and EcoHealth Alliance. And the seed funding for this initiative was provided by the Ministry of Environment from Germany that will support us through the first phase of this initiative for 8 years. In this initiative, we have selected 6 countries to start the work with. And one of them, it's Mongolia, which is the work will be led by the World Health Organization for Animal Health. And for that, I will give you just a brief overview of what the activities that we will work and why we selected Mongolia. First of all, we have initiated a call for interest. We have received around 50 proposals from countries. And from those, we have selected 6 to start with the process. But hopefully we'll expand more and we will have more donors supporting this work so we can support more countries in the future. So for Mongolia, it's a landlocked country. We have a small population, but a third of them are nomadic or semi-nomadic populations. And we have 90% of the coverage of the land. It's about desert or pasture. And we have climate conditions associated with this. Importantly, we have large livestock population with more than 70 million. And we also have a thriving wildlife component, including a lot of species from mammals and birds. Now, all of this, we have a lot of drivers that at play in Mongolia, including a lot of land use changes driven by urbanization, mining activity, agricultural expansion, and this has led to habitat fragmentation and ecosystem degradation, which increased the likelihood of the people coming into contact with wildlife or the wildlife coming into contact with livestock, and then this exchange of pathogens that might happen and increase the likelihood of spillover event of zoonotic diseases. We have also biodiversity work going on there, which is very promising, and we have to capitalize and scale up this work. So that's why we selected this country to start the implementation. And our first work will be with them to scope what's already existing in the countries, what are the initiatives working on One Health, on environment and health, and then try to identify the gap and plan interventions that can support us to work on prevention of pandemics. Now, the last initiative that I would like to share with you, we call it Eco-Regions Project. And in this project, it's in 6 countries in North Africa, where we are working to define the eco-regions in these countries and taking into consideration Earth observations and how these climate change and environment factors affect vector-borne disease surveillance in the country, diseases in general, and the surveillance that should be happening in these countries. And it's led by the World Organization for Animal Health and our collaborating centers in Italy and NASA in the US. So the objective is to get the information in these countries about environment and climate factors, and then to build a prototype application for monitoring vector-borne diseases. So we will support risk-based surveillance, early warning system, and assessment of the introduction of vector-borne disease into these countries and the likelihood of persistence of these diseases. And we selected the Rift Valley fever as the first disease to start the application of this project. We started this project last year. We did a very thorough literature review on existing work in those 6 countries in North Africa. We defined the Earth observation data that we will collect and the system that needed, the statistical analysis that should be done, prepared the Earth observation data and our models. And now we are ready for the implementation, which will start by presenting this work to our colleagues in the countries in December, and starting the implementation from January onward 2024. This is the technical overview of this project, and as explained to you. And these are the type of environment or climate change issues that we will look at and get information from it and try to lay it over the disease information. So we have the environmental information, the disease information, and try to see where the vector-borne diseases are more likely. This approach is very flexible, so we can add more layers to the system, to the models, to explain more what's going on there, including, for example, animal movement pathways, which could be a factor in vector-borne disease, but also in Rift Valley fever in particular. And we could include all these layers in iterative way, one by one, to get more accurate results. So with this, I would like to thank you, and I look forward to the discussion. Thank you, Hannah.
Thank you so much, Shadia. That was an excellent introduction. Really, really incredible stuff your team is working on, and a really good segue into everything we're going to be talking about. I'm going to go into the question set now. Just before, I just want to mention, I apologize if it was unclear before. Just to clarify, please put your questions in the Q&A tab, not in the general chat, and we will respond to them after. Thank you so much. So moving into the discussion, yeah, I want to start by just kind of asking you guys to share a little bit more about your experiences, because you've all been very involved in this realm in different ways. So drawing on your academic and practical work, could you please share some examples you've observed of successful environmental health initiatives that draw upon the One Health approach? And whoever wants to chime in first can go ahead.
I can start if no one else wants to. And thank you, Shadia. That was really an excellent presentation, and congratulations on that excellent work. Much of my work builds upon the kinds of principles that Shadia showed and broadens it to more explicitly include the upstream drivers of health. And so thinking about what's happening, particularly in our cities and the vulnerabilities in our cities. I've done quite a lot of work over the years on heat-related morbidity and mortality, and looking at the various sources of vulnerability. And that includes not just demographic characteristics of the population, age, burden of underlying chronic diseases, proportion of outdoor workers, pregnant women, other kinds of groups that are vulnerable, but also thinking about the environment. That we know that regions that have less trees, for example, are hotter than surrounding areas. And often in cities, you'll see that the areas with the most trees are those where people with higher incomes live. And so it's the poor and the marginalized who live in places that have fewer trees. Those areas are hotter. They also may not have access to quality food. Certainly in some parts of the world, there's not many sources of food in those places. So they eat poor diets, they have higher rates of chronic diseases, which puts them at further risk of the heat. So thinking about, as Shadia clearly showed, these systems-based approaches, the different kinds of interactions that are taking place. And we need to understand that if we're going to make effective interventions, because certainly for heat, one of many effective interventions is thinking about tree planting programs. It takes a while for trees to grow up, but having trees can make a big difference. Having trees, though, then ties in with some of the comments that Shadia made about vector-borne diseases, because we're seeing, for example, dengue fever now arising in some cities in Africa. And emphasizing, as she did, that you have to take these systems-based approaches to understanding the challenges and making sure our interventions are effective, not just for that particular issue, but in the broadest scale. Thank you.
Thank you so much for that, Dr. Ebi. Dr. Ikwara, would you like to share at all about the tree planting initiatives that you've been engaged in Kenya through your organization? As Dr. Ebi just mentioned that, so it might be something worth sharing. Okay, well, if you perhaps if you can hear me, let me know. Otherwise, you can chime in at any point. Dr. Waynes, did you want to share anything else on that in response to that question?
Thank you, Hannah. From the example that I shared with you, we are working on this system approach to bring the three sectors together. We have also other initiatives like the tree planting. I think a lot of countries, they are working on how to try to restore biodiversity, bring it back to existence. And where the land was cleared for agriculture, how to bring back maybe a part of the forest and try to maintain this balance between nature and the human and animals. We have other initiatives about mainstreaming environment into One Health, not just the initiative in the field, but also at the academic level, where we are trying to bring the environment aspect into the curriculum for many of the graduate universities, but also undergraduate. Recently, we have some work being done there.
Thank you so much for sharing that. And what would you say are some lessons from the initiatives that you've both been involved in so far that you've already discussed? Here's some major takeaways.
I think the first key message is partnership, that we have to have partnerships outside of the health sector. I work a lot on early warning systems. You can't really develop those without partnerships with meteorologists and in some cases climatologists. If you're thinking about tree planting programs, you need to understand how climate change is affecting the local environment and what that means for what kinds of trees you're going to plant. That the trees that were successful in past decades may not be successful in future decades. Whom do you talk with to make sure that you have that kind of expertise? And thinking as broadly as we can about the partnership. Heat wave early warning systems, we know that the people most affected are typically marginalized, who are the trusted voices for those marginalized populations? These are just some examples, but to move beyond the kinds of partnerships we've typically had within the health sector and reaching more broadly, as shown in the collaboration that Shadia showed, where you have broad partnerships where each brings their own expertise, working towards the common goal of increasing resilience and sustainability.
If I may, Hannah, add to the excellent point from Chris about partnership, I would like to add also that it will take time. There is no quick and magic solution to fix it, because we've been doing harm to our nature for long. So it will not be 1 year that we will be able to reverse this. We need some time to do it, but we have to start now, because we don't have time ahead of us. And as recent study have shown, that we have crossed 6 of the planetary threshold out of 9. So we are really in a dangerous zone here, and we have to act with urgency. The second one, it requires investment. We need sustainable funding for this. Projects, small projects or initiatives are good, but we need the long-term sustainable financing for this kind of work to be able to make meaningful impact. And the third one, to achieve this financing, and we need to have the political buy-in from our parliamentarians, from our policymakers, that this is the way to go, and we have to make it happen, and we have to invest in these projects. Thank you.
And if I could add briefly to that last point, Shadia, it's been interesting in climate change and health that there is buy-in at the highest level. We hear about the importance of climate change and health, about the importance of One Health from prime ministers and presidents, but it's often the health funders that don't understand the importance of these partnerships, or don't have mechanisms for co-funding with other sectors. And there's lots of work that needs to be done in terms of that investment and making sure that the people who do fund research and implementation understand this importance of having these integrated partnerships to be able to find effective solutions.
Yeah, no, I think these are like extremely important important concepts, the idea of interdisciplinary collaboration and breaking down these silos that we've gotten just too comfortable working in. So you've both already alluded to how this kind of manifests itself in the field of environmental health and climate change and health specifically. What other challenges and barriers do you believe exist to incorporating One Health into environmental health programming, research, policy development? And if you want to share more about this kind of sectoral division that exists as one of those barriers, that's definitely an important topic to discuss.
One easily solvable, but it takes a while, solution is to learn to talk with people in other sectors. We all have our own languages. I had an experience many years ago where we ran the first workshop in the United States, bringing together meteorologists, climatologists, and people interested in weather, climate, and health. As it was the first meeting, we decided that the first presentation would be from a well-known entomologist talking about vector-borne diseases as an illustration of why people in health, researchers in health, needed to partner with meteorologists and climatologists. As the organizing committee was standing around just before this meeting started, a well-known meteorologist came up holding the agenda and said, I'm so happy to see that you people in health are going to talk about something meteorologists know quite a bit about, and that's diseases borne on the wind. Because in meteorology, a vector is the wind. And so they use arrows, and that's the term they use when talking about wind direction. And so for years, we had slides that showed an arrow and a mosquito. They're both vectors. And we do have to learn those languages. We have to be able to learn to communicate with each other. Ask the questions of, are we talking about the same thing, or are we talking past each other without realizing it? It's wonderful to do this. It's a great experience. My experience with every person I've talked with in meteorology is they are just delighted to help and are more than willing to sit down and talk with people. And so we do need to have that practice of talking in different sectors. And that also makes collaboration easier, that many people in the health sector don't know anybody in their hydro met services within their country. And helping facilitate those discussions, making sure that people get to know each other, is an important step forward in developing the collaborations. It's a little more challenging at the local and national level, because there just often are not those collaborations within a country, as opposed to at the international level, there's collaborations with WHO and FAO and others. Shadia, would you like to add to that?
Yeah, thank you so much. I totally agree about the understanding of each other. Even when we were working to develop this joint plan of action on One Health, when we talk about environment health, some of us working in the public health sector, we thought about water and sanitation, waste management, while the people working for the environment part, they thought about ecosystem degradation, biodiversity loss. So this, they are linked, but they are not the same. So we need to find a common language that we agree on. When we talk about environment, what do we mean? The health of the environment or environmental health? So definition sometimes can be very helpful for us to better understand each other.
And we have a
So just
supportive comment in the Q&A, exactly right, from Palestine.
Right. I like the concept of the system approach initiative. Absolutely. It's learning to work in systems and not silos, not divisions or disciplines the way that we're used to working in.
Yeah, but
and you guys
Hannah,
brought up.
yeah.
Go ahead.
If we want the sectors to work together, we have to find them mechanisms to make it happen. So this One Health coordination mechanisms at country level, regional and global, they are very helpful. But again, they need to have financing to do joint activities, joint events, to have a work plan of actions to do it together. So we start with the setting up those mechanisms, and then we have to look at the way to maintain it and sustain it through the years.
I think another way of saying the same thing is it needs to be somebody's job. That initially, when people reach out and talk with someone in Hydromet, for example, it's because of shared interests, but ultimately has to become institutionalized. So it has to become part of job descriptions, that there are people who are responsible for doing that. And it's not just based on the fact that some of us have these opportunities, which we appreciate, we take advantage of, but the next generation may not.
And would you guys be willing to share some of your observations in terms of what's worked in this area? I know you mentioned, Dr. WEBi, actually creating it within the job description but so institutionalizing it, as you said, but just other kind of ways beyond this that can facilitate even just the creation of these channels to get the discussion started.
There are lots of success stories, and they all start at different places and have different pathways.
Right.
It's excellent there are so many success stories. There is funding under the United Nations Framework Convention on Climate Change around adaptation to the risks of a changing climate. The first project involved 7 countries, and several of those countries, and I'm not sure, I haven't followed up, so I don't know exactly if it's all of them or just part of them. At the end of these 3 to 4 year projects, the ministry, even in low resource countries, hired somebody to work specifically on climate change and health, to have someone who would work across the ministry with the different departments, surveillance, vector control, maternal and child health, but also to work with people in their Ministry of the Environment, in their meteorological services, to make sure that those linkages were being made, looking for opportunities for early warning systems. And so that has been quite effective. A second is early warning systems. The World Meteorological Organization announced at the last conference of the parties that they will be investing about $2 billion into early warning systems. There are several countries now that are working quite hard between the Ministry of the Environment and the Ministry of Health to develop early warning systems to protect people when hazardous conditions arise. Heat's where most of them start, but some are looking at spread of vector-borne diseases as we're seeing vectors change their geographic range. And so those also are success stories. And it sounds like some of the examples that Shadia talked about are real success stories as well.
Yeah, no, absolutely. And really, really nice to hear like a positive perspective when sometimes this field feels a bit dark and less optimistic.
Yeah, and Hannah, there is a lot of work also going on in the health sector to make it climate smart and green health system, including how to the supply chain of the health system, how to make it more climate friendly or environmental friendly. Using solar power instead of electricity, especially in areas where we don't have these resources. There is some work going on there, and hopefully the animal health sector is also looking at this initiative from the public health and trying to replicate it in the veterinary services and to make it green and climate friendly.
Right. That's really encouraging. Yeah, like on the topic in general of positive initiatives, Dr. Patrick Ikwara unfortunately is having some issues with his internet. Oh, it looks like he's here with us. So maybe Patrick, if you'd like to share with us a bit about what your organization is doing as well in Kenya. Sorry, you're just on mute.
Good evening.
Yeah, speak again. It was a bit soft.
Are you getting me?
Yeah, somewhat. Go ahead.
Yeah, as I'm Patrick, I'm from Kenya. So happy for discussion. Nice opportunity to present the one of meeting. So far, as the topic of as you see the climate change and health is an issue that cuts across the all sectors that
Sorry, Patrick, do you mind just speaking a bit closer to the speaker? It might just be more clear for us then.
Hello?
Could you just could you talk a bit louder and try to speak into the speaker? It might be more clear for us.
Yeah, are you getting me?
Yes, it's just a bit mumbled, but go ahead. We'll try our best.
Okay, Sasa, so as I say, climate change catastrophes or sectors, the environment.
Sorry, you're muted again.
Even public health, public health and what? Because you see, climate change catastrophes, this is climate change in education. Basically, first to ever understand what are the major causes of climate change. I think in Kenya and across the world, Kenya here about some good urban areas. For example, Turkana, Mandera, Yolo, that you see more
Sorry, Patrick.
more.
We're still just having a bit of trouble hearing you. Maybe if you turn off your camera, it'll be a bit more clear. And I'm not sure if you're wearing headphones, but sometimes I find removing the headphones actually makes it more clear. Like if you disconnect the headphones so that you're speaking directly into the audio. Sorry about that.
Hello.
Yes, that's a lot better. Thank you.
So are you getting me?
Yes, perfect.
Okay, so now, as I said previously, Patrick, I'm so glad to be in this group for this discussion.
You're on mute again, Patrick.
That shows that this is the real climate change. So, climate change, as you say, it causes administration. We talk agriculture. We talk even roads and public work. Is a cross-border issue. For example, I was saying that here in Kenya, the specific assault areas, Turkana, Mandera, Isiolo, and even in Busia, as we factor in the major effect of climate change, the positive change effect of climate change. For example, I talk about the drought, the famine, that basically affect our young people that cause those deaths and diseases. For example, malaria, typhoid, and dysentery. So, horrible diseases. So now, the link between climate change and health between in animals and human beings is a cross-cutting issues. One, through coming up with initiatives like what we are doing here in Kenya as my leader initiative Kenya, this mitigation program as basically goes in hand in a global warming issue, the world mitigating the global warming issues. As per the carbon credit, as now talking about carbon emission. For example, we talk about these the green gases. We talk about these vehicles that we're seeing crowding borders. For example, in Nairobi, Malaba, and Busia borders. So those carbon oxides, how are we going to make sure that we are going to reduce and mitigate those emissions? One, to ensure that trees play a very big role, as we see, is a nullifier. They nullify these the carbon emissions. We plant more trees. For example, we have got a program in Kenya, both in community and in a community engage the school children, the community at large. One, engage the youth, women, people with disabilities to do capacity building on the importance of these tree plantings. For example, we can't talk about climate change without involving these young generations through drama, skills, and poetry as a source of past information as a mitigation measures. So now, through this, basically on pre-planting programs, we involve these young people on tree nursery management. We come up first with the tree nurseries. When we come up with a tree nursery, we ensure that that's a backbone of tree planting. We produce quality seedlings, both indigenous, exotic, and fruits. So for fruits, as we know, those fruits now is for the issue of nutrition. And those young people are malnourished, so we engage on tree planting and value addition of those trees, of these fruits, to ensure that these children feed on this. So climate change and environment, that's a and health. So when you talk about health, we need to involve even tree planting as fruits and foliar addition. These fruits that they eat, they treat and improve more immune system into their bodies. So when it comes about the animals, we do fodder. This fodder, both medicinal. Secondly, they improve the nutrition of animals. When they eat this fodder, for example, calandria and sesbania, they act both as medicine. Secondly, they act as a source of milk production, quality milk production. Now let's go to organic farming as smart agriculture. Organic farming as smart agriculture towards mitigating the issue of climate change by not affecting our soils through chemicals. You see, when these chemicals go on the ground, these animals eat and they die. These young people eat these affected fruits and even affect them. So now we plant more trees, number one, we do advocacies through green initiatives, adopt a tree program in both schools and the community level. So in schools, what we usually do, we involve a child to adopt a tree to make sure these trees are grown. So you find that here in Kenya, our country, Kenya, has, in fact, I'm so happy that in its history, Kenya hosted the first climate change summit and the climate change week. And whereby, as you talk about the issue of policies and policy implementations, the issue of mitigation, the issue of adaptation, the issue of carbon credits. So we are so happy. So now, the major big problem that we're facing as people on the ground that are trying to mitigate these climate change issues, one, it is indigenous knowledge. The indigenous knowledge whereby the community itself, we need to do capacity building the community itself to ensure that they know the reason why they are doing this tree planting and why are they cutting the trees. When they cut the trees, they're saying because of poverty. Poverty index is very high. That is why they ensure that any tree that's available, any fruit that's grown, they cut down because of charcoal. That's number one. So when they burn charcoal, you see they're reducing the trees. And the tree that has been reduced, it takes time again to mature and produce more fruits. Number two, we have got the issue of gold mining here in Kenya. Because I think they leave these gorges and affect our soils. The issue of sand harvesting here in Kenya. You see, even these floods that are happening basically here in western regions, and even Mandera, Turkana, Samburu, and those places. Like recently, we lost more than 20 children. We lost more than 20 children due to floodings. So you see this young generation perishing because of this type of issue that can, once the stakeholders, the key partners collaboration, when we collaborate together, you can actually make sure we have information in more than to ensure that information, they take information home and make sure also they tell their parents the importance of mitigating and the importance of taking care of the environment. When we talk issue of plastic bottles, the issue of plastic bottles, the issue of solid waste, there is a major problem in our cities. When you go to Nairobi, when you go to Kampala, when you go to Nairobi, and go to Mombasa, there's a big problem that faces on the ground. The issue of one, both solid waste, liquid waste, and even the issue of stakeholders and as in the Amazon of Kenya, we have launched a 1 million tree planting, which is indigenous, specifically indigenous tree planting, so that we mitigate the issue of deforestation, basically in our hilltops, our riverbanks, our wetlands, and our streams. So
Sorry, Patrick,
by
we're just
doing
having some
that,
issues with the
we
internet,
make
I
sure that
think, on
at
your end.
least we have a put. Hello.
Yeah, sorry, we were just having some issues with the internet, but we caught most of what you were saying.
Hello?
Thank you so much for all your inputs on that. Sorry, for the next time, just to let you know, I'm wondering if maybe if you turn off your video, if maybe it'll be clear or there won't be issues with internet. We caught you for a while and then it started breaking up a bit. Did you want to finish, just turn off your video and finish what you were saying?
So I'm saying that one,
Mm-hmm.
we need to make sure we have workable policies and policy implementations towards climate change, mitigation, adaptations. For example, we have got the Paris Agreement. That's number one. Number two, we have the Kyoto 1997 that talks about all those, the issue of carbon credit. We have the Vision 2030 that you have here both in Kenya and other countries. But the problem is implementation of these policies and acts. Number two, the issue of financing. We need to come up with a clear model and make sure that we go to the grassroots level to ensure that these young upcoming organizations that are doing a great job in the grassroots level are funded.
Right.
Again, number third, this we need to come up with at least one-on-one interactive sessions, apart from Zoom meetings, apart from maybe meetings. We need also come up with a model. At least when you see you have a successful story in a certain country, for example, in UK, Germany, China, or even in Kenya, we use and learn as a source of benchmarking. So now, even when you see, when you're ground, you say, okay, this organization requires this funding, because already you have seen what are they doing on the ground. Lastly, as an issue of climate change, youth, and health, we need to come up with a good model. As I said earlier on, this involved these young women, the teenagers in the villages who are young teenagers, the youth with disability on the issue of climate change issues. And lastly, planting and growing of trees. You know, there is planting and there is growing of the trees. What do I mean by planting? We can say even let us mobilize more than $1 billion US, and we plant even 20 billion tree seedlings in a day. It is very possible. But what is our objective of this of the planting of these trees? One, we need the canopy. Secondly, we need both tree cover and forest cover. Then furthermore, we need the carbon sequestration, the atmosphere clearance and whatever. So by doing this now, we need to put more emphasis on tree growing in the programs, not tree planting. So if we plant, assume now I'm launching 1 million.
I think maybe we've lost you, Patrick. Are you all able to hear me, or it's not my internet, correct?
No,
I guess
we can
it's
hear you,
okay.
Hannah.
Okay. Sorry, Patrick, for the sake of time, I think we might just move forward with the next question, but thank you so much for sharing everything about Linda Manzagira's initiatives activity. It's been extremely interesting to learn about it, and I'll just emphasize as well that Linda Manzagira initiative, which Patrick is part of, has so far planted, he's shared with me 65,550 indigenous trees in schools, riverbanks, hilltops, sand harvesting hotspots, and other locations across Kenya. So he's really kind of a great example of someone that's working on the ground at the grassroots level with these communities that have the Indigenous knowledge on a lot of this stuff, and mobilizing people towards addressing these issues at a more grassroots level, which is a nice perspective to bring in to the discussion on the research and policy stuff as well. Yeah, just moving on for the sake of time, I just want to ask one more question to the speakers before we receive some questions from the audience. And that is just in general, I know we've discussed this already, or it's been integrated into your responses already, but if you could just share again some ideas that you have for just concrete projects and policies that can be put in place to support the integration of One Health into environmental health solutions, and specifically what types of policies and projects can be done, again, to address the disciplinary silos that undermine the collaboration that we discussed being a necessary component of achieving these objectives.
Shadia, would you like to start? This is what you're working on with your project.
No, it's okay. Thank you. I think from what we heard, I want to highlight two new issues, maybe. One of them is the legislations, because we need to have the legal framework that support our work. So, for example, if we talk about mining projects or development project, even clearing the land to build a factory or something, we need to have in the legal system embedded the impact assessment to ask those companies or those entities who wants to build this factory to do impact assessment and show that what would be the effect on humans, or on the animals in the area, on the environment itself. And then we take a collective decision to go ahead with it or not. But this needs legislation. The second one, it's about the youth involvement. And I agree with Patrick that it's very important in this initiative that we are doing. It's not just the professionals or the technical people should be involved, but we need to involve the communities, including youth and women. The gender aspect is very important, and it's often neglected in these initiatives. Thank you.
Thank you, Shadia. And I'll start at the other end, which is whenever you're doing a project, think about the opportunities for bringing in other sectors, bringing in other perspectives, because most of the projects you work on will have an opportunity to bring in One Health. And so finding ways to help facilitate those collaborations, perhaps this is a role that the international organizations can take on to help ensure people within ministries of health, ministries of the environment have an opportunity to meet and discuss with each other. And then you'll strengthen your own collaborations as you think, oh, I'm working on this issue, and boy, if I could bring in someone from the meteorology department, somebody who's working on ecosystems, somebody who has an understanding from outside the health sector, would enrich the work I'm doing and make it more effective. There is a question in the Q&A about prioritization, and it goes to this as well. Just start where you are and do what you can and intentionally work towards building these larger networks, and you'll be surprised how quickly and effectively that will make a change.
For the prioritization issue, I think it all depends on the context. We have different degrees of One Health implementation in the countries. Some of them, they are more advanced. They have coordination mechanism. They have joint initiatives. Others are less so. So we have to start from there, understanding the situation. And then from the 6 action track that I shared with you, which one to start with? Should we start on reducing the risk of pandemics, or we work on rabies, neglected zoonotic diseases, or we work on antimicrobial resistance, This has to be done at country level through this consultative process where all the sectors should be involved, including the finance sector, not just environment, health, and animals, but and urban planning, land use planning entities that are responsible for this, and then decide which area should we start with, giving our current human resources and financial resources. Thank you.
Yeah, those are excellent insights. Patrick, are you back with us again? If your internet connection is stable, it would be great if you could share actually on what's being done in Kenya in terms of bringing together civil society organizations on this topic. Since I know you're a committee of the forest you're a representative of civil society organizations on the Forest Conservation Committee. Are you with us currently, or would you like to perhaps you can respond later if your internet's inconsistent? Okay, yeah, no problem at all. I think we can all here respect that coming from different parts of the world, it's hard to get good connection in all places. So no problem, Patrick. Just feel free to chime in because I don't want to cut you out of the conversation. But thank you so much to both of you, Dr. WEBi and Dr. Weines, for your incredible insights that you've just shared regarding ways to move forward and in providing a positive perspective and some optimism on really, you know, what can be achieved if the will is there. I think that's a really good place to leave it for now, as we move into the questions from the audience. So I'm just opening up the Q&A here to see some questions, and please feel free to type in more for those in the audience that have questions. Just type them in the Q&A, and I'll try my best to get them to have the speakers respond to all of them. So we have one here from Yasser Issa. He or she or they have said it's already, if we talk about One Health approach, to include all sectors outside the health sector. In Palestine, I'm working in the Environmental Health Department, belongs to Ministry of Health, but in several issues, we collaborate with other sectors like the Ministry of Agriculture, Veterinary Department, in controlling some zoonotic diseases like Brucella, and with the national economy. Now we work on climate change and health. It is obligatory to work also with meteorology departments and with pesticides prevention departments for food safety. I think there's no way to separate these sectors if we talk about One Health. Right, so this is more of an insight than a question, but really a great one. And thank you so much for sharing that. Yes, they're really interesting to hear what's happening in Palestine. So here's a question we have from Fadi Basha. Is there some kind of prioritization between the elements of One Health, especially in projects with limited funding? And so yes, if one of you want to respond to this, if anyone has ideas, I guess kind of the question is how much this really is being prioritized given the limited funding that exists right now with so many things underway.
There is increasing prioritization of this issue with increasing recognition that not taking a One Health approach means that we're not being effective and efficient with our resources, that our solutions that we identify may not be as effective as they could be. We could be blindsided because we're not paying attention to the interactions with other sectors. And so there is increasing emphasis at all levels. Many countries now have statements about their intention to include One Health approaches. The UN has made it clear that they're promoting One Health approaches. You've heard about the excellent project that Shadia is working on. So this is really important and is being prioritized. And as we said before, of thinking about in all of your projects how to incorporate a One Health approach to make sure that they are as effective as possible. Thank you.
I guess just a follow up to that I would want to ask is also like, what are some of the arguments that are most powerful in making funders invest in this issue, or those that actually have the money and the power and the capacity to support these initiatives, such as governments and donors? What are the arguments that can be leveraged that are most compelling, or that convince them that this is a worthwhile investment?
There's lots of examples of what happens when you don't. And I'm sure all of you can think of examples of what happens when you don't, and how important it is to make sure that we do use our resources as effectively as possible. And so it depends really on the question that you're asking. We're going to be hearing more about best practices from the projects that are ongoing. If you can't identify a best practice, then you certainly can identify a poor practice where decisions have been taken in health without considering what goes on in other sectors and vice versa, and use that as a compelling argument of really why we have to collaborate.
Yeah. In addition to this, I think it's important to show the return on investment. So if you put $1 in prevention, how much you will get back. And we have some evidence that investing in prevention is most cost effective than investing in preparedness or response, at least 6 times the difference. So it's very cost effective to work on prevention and to in addition, it's not just the economic part, but also think about how many people we lost for pandemics like COVID-19. It's millions of people died because of the virus. While if we prevented the spillover of this virus, we could have saved those lives and saved the suffering of the people with the disease, including the long COVID that we have to deal with now. So it's the economic and also the perspective of the burden of the disease if we don't act on it.
I think those are really, really good points in terms of the fact that we have already seen the costs in many examples. It's just, I guess, unfortunate that in some cases it feels like we have to see the costs before we really feel their weight or recognize what what that looks like. I guess that's kind of our nature as humans, and probably a flaw in dealing with this type of thing. Another thing that I'm aware of being done currently to try to better create compelling economic arguments towards this is the costing of ecosystem services. But I know that that's something that's very, very difficult to do, and that how do you quantify the actual value of something like fresh water from a river, or something like pollination services that lead to, you know, that underlie our food systems and our crop development, and these massive have these massive implications. And so these are also some barriers, but perhaps they provide an opportunity for new methodologies to be developed in the realm of research towards quantifying some of these things, and actually being able to really make a case for the value that these ecosystem services have that we know inherently, but to speak in the words of some, we would need to put quantitatively, perhaps. And thank you, Chadia. I noticed you've just put a great report in the chat. Yasser Issa also shared, according to Animal Health, I think as a result of our collaborated work, sometimes after discovering the spread of zoonotic diseases, this leads to us conducting animal vaccination campaigns in our country. I agree this work should be systematically organized with a mission, objectives, and action plans in order to safeguard humans, environment, and animals' health. And yes, that's fits very well with what we just said, and that sometimes it's seeing the consequences of inaction that triggers us to start a new action. But yeah, very, very interesting example with zoonotic diseases and vaccination campaigns, and interesting that that's you've seen that in Palestine as well. So again, I encourage everyone to ask questions in the chat. We don't currently have too many from the audience, so I'm going to just move into some concluding questions with the speakers, given that we have 15 minutes left. But the Q&A channel is still open, so please do put them there, and I'll try my best to weave them into the discussion so that they can get addressed in our last bit of time with our experts. So yeah, moving on from that, we've been discussing kind of a lot of ways that we can sort of create a more compelling case for investment in all of this. Something else is the use of technology, which we haven't talked a lot about yet. And I'm wondering if you guys have any insights on technological advances that may be harnessed to improve our strategies for responding to environmental health threats. And whether you've seen this starting to be incorporated into any of your work as we move into more of a digital age and have all these new developments underway with artificial intelligence, for example.
There's quite a lot that's being done in terms of using remotely sensed data. There's been some use of that in health, but not particularly extensive. And there's a number of projects. There's a project funded by the U.S. National Institutes of Health, developing heat wave early warning and response systems in 2 countries in Africa. And a critical part of that is pulling together remotely sensed data about our cities, understanding which parts of cities are hotter, pulling in weather data, pulling in socioeconomic data to have a more comprehensive view in a data set that allows you to do other kinds of analyses. And that's just one of many examples of bringing in the remotely sensed data. And there's so many technologies that are being developed. You can think about improving our surveillance systems using cell phones. The list is extremely long. There's also new technologies being developed. There's now little data sensors that are about the size of a pill that someone can swallow, and it actually measures heat stress in somebody's body without mostly using secondary sources that are not necessarily as accurate. And so I would expect there'll be an explosion of new technologies in this space to better understand these intersections between human health, animal health, and the environment.
Yeah, that's really fascinating. Thank you for sharing some of those examples. And also, just for the audience, if any of you guys want to chime into the conversation and add, success stories, examples that you've heard of, technologies and developments underway, absolutely use the Q&A chat for that as well. You're free to share so that this can be more of a joint discussion, because it's always so great to hear from voices in different parts of the world. Yeah, so that's really interesting, and I hope with the shifts underway in advancing technologies and with the youth generation having grown up in a largely digital age, they can kind of bring some more innovations to the table. It's kind of an exciting time as far as that goes. And so just now, I'd like to kind of move the conversation also towards engaging the public and communities, because obviously there's a very big role for academics and experts and policymakers and diplomats and people working in these specialized fields and technical fields. But beyond that, really, I think we've come to a point now in this crisis where we can't afford for this to be exclusively the work of experts, exclusively the work of a few. This needs to be all of our work. This needs to be our joint project as a species. And so given that that's the case, what would you guys recommend, having worked in this space, in terms of engaging the public and engaging communities to actually take action and adopt behavior changes that would be positive and necessary to work towards the objectives that we need to achieve?
I can start. I think in all of our project, we have to think of our end users, which is the community. And we have to start working from the planning phase to plan it together, to understand their needs and factor it into the projects or the initiatives. And then along the way through the implementation, to find areas or events where we can hear from them the feedback on the projects, and then try to modify it to meet their needs. Of course, we have the issue of indigenous people in many communities that they feel marginalized and their voices are not heard. So we have to take extra attention to this issue. Thank you.
I completely agree. And I'll add something I know that Shadi intended to say, was that we need to engage them from the beginning. That we don't think of the ultimate users as a group we engage at the end, but you start with engaging them from the beginning of a project to help understand their interests, their needs, what's going to be most effective for them, and how this project can help them. And when that happens, then you see much greater uptake of the projects, you see much greater uptake of the results, and it makes a completely different situation. So partner with the end users from the start, and you'll be impressed with how effective the project will be.
Thank you. That's really, really great insights again. Because we've mentioned the topic of working with Indigenous populations and also engaging them as active collaborators in this process of finding solutions. I'm gonna just turn it back to Patrick, if you're here with us. He's been doing a lot of work with Indigenous populations in Kenya, making best use of Indigenous knowledge towards finding solutions for a lot of the environmental challenges that the country is facing, and that our world is facing more broadly. Patrick, are you with us to share a bit about that? Okay, unfortunately, are you with us? Feel free to. Perfect, thank you. It would be great to hear from you again on this.
Okay. I think there's power in community engagement. Right? There is power in community engagement. And when I go back to in a minute, first we need to, as per community empowerment, we need to identify first, you have to do mapping for any nearby resources for sustainability. When you map a nearby resource that will help this community for sustainability, I think shall be solving some more problems, basically in the issue of unemployment, the issue of poverty, and the issue of maybe this or whatever. So now, as said in Kenya, I'm working with more than 1,000 groups in the Western region in diverse thematic areas and basically in climate change and environment issues.
So as we say that there is no thematic area that is not affected by climate change. So you find this the issue of GVB, the issue of adolescents, the issue. Furthermore, climate change affects young teenagers, basically during their period. One, you see when these groups are affected by malaria and TB and AIDS. So there is supporting groups that basically does mentorship programs on AIDS. So engaging these groups or indigenous community, indigenous groups, you know, so nowadays we find that for us, we usually go first for those people who are educated. And we are forgetting there is a high number of people, high number of women who are not even go to any level of education. And they play a very big role in society. For example, now, if you want to do any project, even though you have got more money, we go with technical know-how, yes, but implementation on the grassroots level is a must that we have to involve this community, these women, these youth with disability, provided that whether they have gone to school or they have not gone to school. But find that the high number of people who work together with all strength, with all capacity, the high number of not going to school. Basically, those women. Women, white indigenous people, white indigenous communities. I think as our other speakers have said, in any funding implementations, because you find the government brings more money in maybe in the community level without involving these communities. So you find that there is no impact that will be seen, because again, you find that these people, they can even resist because they've located.
Sorry, Patrick, you're just muted, but I apologize. We just have a few minutes. I just was going to wrap up the conversation. Sorry, did you want to finish what you were saying?
Hello?
Yes, we can hear you.
I'm finishing.
Sure.
So, in sum up, there's power in indigenous community engagement.
Yeah. Yeah, no, absolutely. Thank you. Thank you so much, Patrick.
I can say there is look projectability and thank you.
Thank you. Thank you so much, Patrick. I'm sorry that the internet hasn't allowed you to share everything you'd like to share today, but we've caught a lot of your insights and they've been incredibly valuable and contributed importantly to the discussion. So just in the sake of time, I do want to wrap it up, just looking at where we're at. I really appreciate all of the insights that were shared today. All of our experts have been incredibly insightful and knowledgeable on this topic, and it's been an honor to be able to facilitate this discussion between you guys and to hear you share some of your rich knowledge on all of this. So just before we conclude, would any of you guys like to share any final words, recommendations? Maybe we can just go around to each of you and you can each just kind of share one more sentence that you'd like to provide on this.
I'd like to thank everybody for joining and encourage all of you to take the information we shared and ask follow-up questions and incorporating One Health into all of the work that you do to make sure that it's as effective as possible. Thank you.
Thank you so much.
Yeah, thank you so much, Hannah, and thank you for those who contributed from the participants. We learned also from them. And I hope that there will be future opportunities where we could have more interaction with the network in the Middle East. Thank you.
Absolutely. Okay.
Yes.
Yeah, did you want to share some final words, Patrick? We're just closing the discussion now if your internet's back.
Okay. What I say, there is power for collaboration. There is power for partnerships. Let's partner. Let's collaborate for the betterment of our societies and of our communities. Thank you very much.
Thank you so much for that. Really, really great closing words. So thank you to everyone for joining us for this rich and informative discussion. And yeah, let's move forward and continue to work towards these really, really important objectives. So thanks to everyone for joining, and have a great evening, morning, or afternoon, wherever you are in the world.
Thank you. Goodbye.
Thanks. Bye.
Bye.